So we have a contract with Finger Lakes Therapy Works, and we've had it for a couple of years. And what happened, if you remember, is that for the EI program, our providers stopped doing the service coordination. And this has happened across the state. And the reason that they're not wanting to do that anymore is because they lose money on it. The state just will not up those rates. We've been having discussions with them probably for a decade, so it's not worth them doing because they lose money. So what we did is we contracted with Finger Lakes, because the other counties around us ended up having to hire people to actually do it. It's a mandated service. Every child needs to have a service coordinator to make sure things are copacetic, et cetera, et cetera. But this was a very good thing for us, and they do a good job. However, our numbers are up, and it's been too difficult for them. They've been losing money too. So Tammy, the president of Finger Lakes Therapy Works, has notified us that the dollars that we're giving her are not enough to cover her expenses. And so she is requesting that we give her, instead of $40,000 annually, that it goes up to $100,000. Now, if I have to hire, if she won't do, and if we don't give her the money, she's not going to do it, because it's difficult. This is a small company, you know, it's not like they have these huge overheads that they can cover it. But she's willing to continue, but I would have to hire 3 FTEs, which would cost probably $300,000 to the county. So I have talked with Chris about this, and he's in agreement that we need to do this. So if you agree.
Can we try, could we do this, since it's such a cost-saving measure, to make this amendment, propose a 2-year, or are you allowed?
We could. We haven't had that discussion with her. And I have money in my preschool budget to cover this, so it doesn't have to go to the county's contingency. So we're lucky there. And that's what that budget transfer is to be able to cover this.
That's within your own.
Yes, and I didn't know about it to be able to budget for it last year, so.
So I'll move B through G as a block.
Thank you.
That's
Second.
I'll second it.
Thank you, Tammy. The discussion? You know, it just briefly, we're running into this everywhere. People can't afford to be in business anymore. And choices do we have?
And this is a very vulnerable population, these children, and it's mandated and it's needed. It makes a difference. So it's difficult. But there just aren't providers. I mean, there's not providers in mental health. There's not providers for the hospitals, for just everything. It's getting difficult. And we actually are fortunate that we're in a better shape than a lot of counties. Yates County has 1 provider to do this. We have enough providers, but it's always, you know, otherwise you end up into a big wait list, and these children really can't afford to have a wait list.
These small companies, they operate on very thin margins.
They do.
As opposed to the for-profit, the big ones in other states throughout the United States.
And part of it too is that some of the organizations that we contract with, they want to do some classrooms to be able to do it together, but they can't get the providers. So we've put money aside every year because they were trying to do it. They can't get the providers to do it. So, and you're if you stop and think about it, you know, it's a challenging work to begin with. So anyway.
All right, we have a motion and a second. In favor?
Aye.
Opposed?